And on the courtyard right now, we do have. Okay, Chester is telling me they lost signal. Okay, Chester, all you have to do is go back. I can see the signal strong from where we are. Once again, we'd like to welcome all of our. Oh, there. You said it's good again. Thank you very much. Yes, I can see it on my Access device. If you are watching our friends in the courtyard, these are students who are learning how to dance itik itik. And of course, born and raised here in the islands, not too familiar with the Filipino culture, and this would be a good chance for them to bring culture into their lives with dance and music. Okay, there. So if you just tuned in here on radio, KNDI, Pinoy Power Media, KRM Internet Radio over on Maui, what you are seeing in the courtyard of the Filipino Community Center, an instructor of Philippine dances teaching our young people who are in attendance here at the Filipino Community Center's Health Fair, which is happening right now in the courtyard as well as inside the ballroom of the Filipino Community Center. I'm Larry Ordonez. Come on down. Umay kayo dito, Yapo. Punta kayo dito sa Filipino Community Center hanggang alas 2 ng hapon po kami dito. And magbibigay po kami ng libreng screening. Blood pressure check, cholesterol check. Also, a lot of the medical professionals are available here to answer any questions that you may have on how to keep yourself in good health. Awisan da kayo amin na sangapa daw. Umay kayo dito, kikita tayo. Ado ti pagparkingan na pintas ti aldaw na init. Dito, siyempre, datayo iti linong na dumaduma dagiti exhibitors sindadan nga tumulong kada kayo kadagiti impormasyon na sayat nga um, maipaay kada kayo. May isa kadagiti banag nga impormasyon nga naadal ko bayat ti kaadak dito ket manipod iti Queen's Health Systems. In sarita da itatay dagiti impormasyon no anya ti pagsinyalan iti stroke. Nadamdamag yo kasano ti papatay na ni kastoy. Sasala da manen kung kahit ang subliak to manen kakabsat subliak to. Okay, so what we will do, we will come back to our itik-itik dancers when they are ready with the full dance because it keeps on stopping in the middle. Kaya't kuman nga tuloyan nga ipalawag kada kayo gagayem kan kakabsat na kitay sinyal iti kaadda iti stroke. Kas naisarita kitay sumagmamano kadagiti amoyo ni kastoy ket natay na stroke kano kunayo kung kunada no ko ket dadtoy duwa kadagiti representante manipod iti Queen's Health System iti imay ditoy sibay tayo nga nangipalawag no nya dagiti pagsinyalan iti stroke ket kunana nga ti stroke ket sumangbay saan nga masaksak bayan. It can happen so suddenly. Isong panunutin datay sarita nga be fast. B-E-F-A-S-T. Be fast. Umuna dahil letra B kaya na nga sa uwen nga masabol nga kitaem iti balansem. No ti balansem ket saan ka nga makatakder nasayaat saan ka nga makatakder nga straight, you cannot stand straight, then and if you have balancing issues may isa dadya nga sinyal, may kadwa nga sinyal ket ti panagkita no bilang laeng kada problema ti panagkita magkurkurarap ti panagkita may isa dadya sinyal. Kastamit no data pingping mo ket saan nga makariklik na data pingping mo may sa dayto yung pagsinyalan ti kadday ti stroke kastamit iti kinalupoy dagita takyag mo saan mo nga may ngato data takyag mo nga may sa wenno daydi panagsaritam ket saan nga agsusurot tiyempunan itingka pinangtawag iti 911. So once again, we'd like to say big mahalo to the representatives of Queen's Medical Systems for coming by and sharing with us very important information for our Filipino community. All right, so let's go back to our dear friends, Dr. Rhea Bautista and Agnes. Welcome back, both of you.
Hello again. We are very excited to have Dr. Rhea Bautista back. And Doctor, I should know you. Please have a seat here with Bayanihan Clinic Without Walls. Thank you for coming here today, Dr. Rhea and
Dory Villaforte.
Yes, of course. I'm so sorry. I didn't recognize you with your beautiful gowns. For me, it's
Now she's not wearing a gown.
I know. Now, for those of you listening, she's not wearing a gown. For me, it's the other way around. Usually, I'm using a T-shirt or a polo shirt, and then when I dress up, they don't recognize me. But please, tell us more about yourself and Bayanihan Clinic Without Walls.
Yes, I represent both organization, Bayanihan Clinic Without Walls and Ohana Medical Mission. I am a volunteer because my husband is also very active in this organization. Bayanihan Clinic Without Walls is a subsidiary of Philippine Medical Association of Hawaii as well as Ohana Medical Mission. Bayanihan Clinic Without Walls do community fairs. It helps the immigrants, whether you're Filipino, Tongan, Samoan, new immigrants, when they don't have medical insurance, they can go to these volunteer doctors and they can be helped. While Ohana Medical Mission is the outreach, or it's the branch that does medical mission in the Philippines. This came about 2 decades ago to do medical missions in the Philippines. We just had a medical mission in Bagong Silang and Payatas, and we helped more than 3,000 people in the Philippines. So that's Ohana Medical Mission. We accept volunteers and financial support from the public. It's a 501. Both of these organizations are 501c3, which means that your donations are tax deductible.
That is very important, and thank you so much for giving us that background. We're very thankful because there are, even during the pandemic, I do remember.
We did. What we did was send money to the Philippines for them to do the medical mission. The doctors and volunteers could not go back to the Philippines because of the pandemic, but we did send some financial support.
Yes, and then Bayanihan Clinic Without Walls, definitely, they've been helping the community here in Hawaii, and talagang nakasaysaya at ito'y tulong da dagiti komunidad tayo at oray awang kwartam triton da ka dagito'y doktor ket talaga daytoy puso da ket it's very full of compassion and humanitarian. And
That's true.
yes, and then you're going to the Hilo, right? Coming
Yeah,
up.
there is a health fair in Hilo, June 19, and this is sponsored by Bayanihan Clinic Without Walls. It will be at the Hilo Plaza. I don't know where it is, but June 19, it's a whole day affair. We invite the people of Hilo to go and see them. Free medical checkup. There will be some. Is there dental also? More medical. Yeah.
More medical, and then this is one where I think it's our first Philcom Care's first collaboration with Bayanihan Clinic Without Walls, and we have some test kits that we'll be distributing. But importantly, I think what we wanted to do is make sure that the community, our role is make sure that the community comes. Ite umaiti community, ijay to Hilo, and
Hilo.
then ijay.
Auponi Center,
Yes.
101 Pawahi Street. So
Good.
there'll be blood pressure, cholesterol, dental, diabetes, endoscopy, a lot of services.
Yes, and it's always so important. Dagit ijay Hilo, awan unay ti Filipino doctors and healthcare professionals. Iso nga no adda dagiti Filipino when they're people who can understand their language, their culture. Talagang waragsakan na. They're so happy when there are those who understand them in their language and culture too.
That's
And,
correct.
yeah.
Yeah. Adun to ti Ilocano nga doktor, Tagalog, Bisaya.
Nalalaing ti Ilocano mo, shock.
Of course, I'm from Pasukin.
Pasukin. Among Dr. Rhea, did you want to add anything to that?
This microphone here is active.
Just for Bayanihan Clinic Without Walls, for anybody who wants more information, the phone number you can call or text 808-518-8929. And then for anybody who needs the medical care, who's newly immigrated as well, you can call LEAP 808-832-5685.
So much. So, amo yung data numero repeatin man ni Dr. Rhea dagiti numero. Manin. Go ahead and repeat the contact information again.
Oh, okay. So for Bayanihan Clinic Without Walls, for the phone number, you can actually call or text 808-518-8929. And then for LEAP, it's 808-832-5685.
And then one more question. Now that you're here, what are your tips for living healthy? Not the recommendation you?
Eat vegetables. Be vegetarian.
Be vegetarian. Are you vegetarian?
No, I'm not.
I'm not even. What is your favorite vegetable?
Tarong.
Oh, me too. How do you like it? In your pinakbet or torta?
Torta or pinakbet or just plain
Grilled.
fried and sausaw. And then
Ooh.
it becomes not healthy because you sausaw in the bugong.
See, okay. So that's what we're trying to educate, right? We're trying to educate healthier. So what do you recommend to others in terms of making that healthier?
Well, one time I'm diabetic, and one time I attended a diabetic class, and the doctor just said, you can forget everything that I said, but you have to remember one thing: just walk, 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 walk.
So it means that you have to take care of your health in many different ways, and walking is one of the best way to stay
Correct.
healthy.
It's cheap.
It's cheap. All you need are your shoes, or you can walk. You don't even need shoes if you walk on the sand.
Sometimes it's not cheap because you don't have the time.
Yeah, that's true. So, what is your routine in terms of walking besides to the car?
Well, after dinner, after I wash the dishes and everything, then I go for a walk.
Oh, that's nice.
Yes. At least 2 miles every night.
Oh, nagsayatan. That's very good.
That's right. I'm training for something else.
Oh, what are you training for?
Well,
Not to give.
should I say?
Not to put you on. Only if one of the things is we don't pressure. But go ahead if you want to share.
I'm training for a walk in Santiago de Compostela. I
Oh,
don't know if you have
wow.
heard of that.
Yeah.
It's called The Way.
Yes.
So I'm walking for 18 days from Leon, Spain to Santiago de Compostela. And it would take me 18 days. So I'm training.
Yes, my friend did that. One of them looked like he was so refreshed. The other one looked like he had been running 10 marathons. But
I don't know if I can do it, but I'll try.
I think that's the best thing. You know, you set your goal, you try. The best thing is you do your best, right?
Yes.
Are you doing it with Dr. Arnold?
No, my husband does not like to walk. Sorry, Dad.
Oh, the
He
truth
said
is
he
out.
will just meet me in Madrid.
Well, he'll be ready there for you.
He'll be waiting for me.
So when you walk, what do you walk in the morning or in the evening?
I walk all times because because you start walking in the morning at 6 o'clock so that you don't get the sun. And you should finish by 2 o'clock. So I'm training at night, in the morning, during noon so that I experience the
Heat.
heat. Yes.
Do you use sunscreen? Nagusar ka ti sunscreen?
Yeah, I bought all my sunscreen.
O talaga ready iso na.
Wow. Commendable.
Yes.
I hope so.
Wonderful.
The- the-
Probably-
I am inclined to ask how old you are, but you don't have to
I will
answer.
tell you, I'm 74.
Really?
Yes.
That's
You look
awesome.
very good.
Thank you.
Yes.
Very
I
good.
think that walking helps.
I have known Dory for many, many years.
Yes.
They've started Bayanihan way back with Linda, Dr. Linda Cachola, Danilo Ablan,
Dr. Agmata.
right?
Yeah.
So many of the old timers.
Yes.
And for you to tell us 18 days of walking, salute to you.
Thank you.
Do you have to carry
You're the first Filipino that will walk that far, except my auntie who've been walking and we don't know where she is.
You don't know where she is. I saw.
No, that's just a joke. No, because somebody told me, walk. If you want to reduce your blood pressure,
Walk. Yes.
Eat half, they said. But my half of the lechon is still big.
Yeah.
Talaga tay extra large lechon siguro ngamin.
Well, thank you for taking the time to share some of your thoughts with us
Thank you, sir.
here. This is great for our listeners. And you may know already that we are live on KNDI. We are live on Pinoy Power Media with their 2 FM stations and over on Maui.
I know that because when I advertise with you guys, the people tell me, oh, I heard it from KNDI.
Well, of course, and of course on tax season. And then we have you during with Auntie Maggie. Yeah.
That's right. Yes.
Yeah. So
Thank
Uh,
you.
great.
Thank
Thank
you
you so
for
much.
having me,
Thank you.
having us.
It's been a pleasure talking with you, and inspiration. You know,
you.
I enjoy the laughter and the smiles here. For those of you nga di kami makita, na talaga isam kami amin. Agkat katawa kami pa.
yes, and Emmy Anderson, who is listening to you, says, "Oh, just reminding everyone, Larry, that we are live 24/7, Pinoy Power Media."
Wow.
Yeah. Yeah. So this
Very
is great
good.
outreach for Philcom
Yes.
Cares, great outreach for Philippine Medical Association of Hawaii. So hopefully, Emmy, if you're still listening, we can continue to collaborate and really expand on our community outreach programs for all the information that are very important in our everyday lives. Important for us personally and important for our family members. Because I'm learning now that if one family member is not doing well, it's very taxing to
It is.
the rest of the members. They have to change priorities. And many of us are going through that now at our age. And so we need to be more mindful on how we can prevent and prevent diseases that will come to us and also maintain good health. And I like what you shared today.
Yeah.
Thank you. Kunak no managbabain ni manang durikit. Nuwag sarita kayong very bold.
Talaga
Thank
ang
you.
shine itang aldaw. Thank you.
All right. Thank you very much. And thank you, Rhea, Agnes. They're still practicing their dance. And so we'd like to remind once again to our listeners, thank you for tuning in on our broadcast. This is a health fair event here at the Filipino Community Center, and it's happening right now.
Right now, and they interview tayo itay talagang nalaing magna. Dapay may isang exhibitor tayo, may bisikleta mo.
Wow.
So mapangko ibaga kingkwanan ready tayo para kingkwanan.
All right, Agnes.
I'll be right back in a few seconds.
Okay.
Oh, I better hurry up. It's like seconds.
Okay. Ala kada kayo amin na sangapada, gagayem ken kakabsat madamayo dengdenggen health fair event mapaspasama kitan dito'y Filipino Community Center iti Waipahu. Na dumaduma dagiti impormasyon nga maibinglay kada kayo, maipay kada kayo tapno tigas target amoyo dagiting kayo aramiden bilang laing ta sasaaden nyo ket kasapulan nyo titulong. No saan da kayo nga matulungan nga insigida, adda dagiti na dumaduma nga luglugar nga mabalinda nga iyam mo kada kayo tapno ti kasta ket makapan kayo sa jay ket agpatulong kayo iti husto nga makatulong iti sitwasyon nga sasaaden nyo. Umay kayo dito, gingana kami dito iti oras ti alas 2. Nangrugi kami ti alas 10. We'll be here until 2 o'clock. So once again, if you just tuned in, come on down to the Filipino Community Center. We'll be here until 2 o'clock. Lots of information can be shared with you, as well as information on resources where you can get help. And this health fair is free and it is open to the public. Now, let's go back to our dear friend, Dr. Agnes Respicio Malate. Welcome back, Agnes.
Hello again. So we were talking earlier about, walking. Now it's bicycling. And I didn't know about this program, but I have Kainoa here. She's with the Department of Transportation. What division are you with, Kainoa?
I work under the administration, but I have the good fortune to manage our electric bicycle and electric moped rebate program.
Awesome. Tell us more about it because I saw, nakita ko dito announcement na yan tatlami saan da. There was an announcement. It says 20% off up to $500 for a bike if you were to purchase one. See, Larry's eyes are going big and so did mine if you're not watching. But this is to help. There is an eligibility, so Kainoa will tell us more about it.
Sure. So last year in 2022, Senator Chris Lee spearheaded a bill, Act 306, that was signed into law by Governor Ige, that would allow folks that are 18 years of age and who qualify under one of three categories to receive a rebate. So you either have to be in a low-income assistance program, so as an example, SNAP or some MedQuest, or you need to sign a self-affidavit that confirms that you do not have a car, so you're not a registered owner of a vehicle. It doesn't necessarily have to be tied to your household. As long as your name is not on it, you would qualify. Or you could be currently enrolled in either high school, college, or university. And if you can demonstrate any one of those things, you could possibly qualify. We offer on the retail price of your electric bike or electric moped. So like if you paid $500, 20% on the retail price, we will go as high as $500 maximum for the fiscal year. So conceivably, you could apply this year and then apply next year if you buy a new bike. Which would be, the fiscal year runs from July 1st to June 30th.
Yeah. That is excellent.
Yeah.
So this is only for electric.
Correct. Specifically electric bikes and electric mopeds.
Okay.
Lots of folks want the scooters, but we haven't been able to get the ledge to move on it yet.
So when you say electric, do electric bikes, do you plug them in or how is it powered?
Yeah, you can plug them in. Mm-hmm. Mm-hmm.
So these electric bikes, are they available all over the place or where's the best place to buy them?
Sure, they are. So the law allows for folks to purchase online. So conceivably, you could buy directly from a manufacturer. But they're also available at Walmart, Costco. Costco has two iterations that they sell. And there are a bunch of bike shops, Aloha Bikes, Hawaii Bikes. There are a few more. I can't remember their names off the top of my head. But
So you heard that. No, di kayo, to get started, if you don't want the manual bicycle, this is the electric. So it's a way to be outdoors. And I think that probably the main goal of this is for us to encourage us, if possible, not to use a car, but use electric bicycles and electric mopeds so that we use less energy. So it's less taxing. So not so much necessarily for recreational, but more for really using it as a primary means of transportation in some ways. And for before I actually ran a marathon, or maybe I should say jogged a marathon. I used to think, oh, it's so far to walk around Diamond Head. And then pretty soon when I was training, it's like, oh, 8 miles, 2 times around was nothing. And so I can see how, at first having this electric bicycle is a way to get started and encourage people to be outdoors, get attuned to being on a 2-wheel rather than a 4-wheel.
Yes, ma'am. Yes,
And
ma'am.
then probably graduating to walking to all the places. So this is very good. Again, eligibility, you told us about the eligibility. So how does, this is reimbursement basis. Okay, so tell us about that part.
So once you've applied, we have an online application, or you can call our office and we can send a hard copy. Once you've applied and you've been approved, we will, based on the math that I've shared, assess how much your rebate is for, and we will cut a check and send it to you.
Okay. So nangyudatan, no kaya gumatang kayo te electric bicycle, no electric moped, and at the opportunity that yung ma-reimburse the 20%. Mas po de te resibo yung mata. You have to show documentation. And I just plug in here, dite bike lane nga kapo mangrugi jay Pearl Harbor. Datunan Ingana, past Eva villages, Mapanpay Ingana. Yes, I know it's really been extended, and they're trying to be very mindful nga dete lugar nga labasan nyo ket amuyong mo no anadagitang lugar. So they have these interpretive signs to talk a little bit about these places. So do you know where it's going to ultimately end?
Oh, no, I'm sorry. I don't know. That one's out of my wheelhouse.
But I know definitely it's now in Kapolei area, and that's really far. So I'm not quite sure how many miles that would be. I think that would be at least maybe 7 miles or 6 miles.
You know what, Agnes, I'm going to go find it, and then I'm going to find you and send it to you.
You
Yes,
called
ma'am.
me on that.
Yes.
Okay, wonderful. So the dete numero no kayat yung amwen pay may panggap dito yung servisyo ti IJ Department of Health, dete Hawaii State Energy Office. The number is 808-587-2160. That's 808-587-2160. Thank you so much for joining us today. I really appreciate it.
No,
And-
thank you so much for having us.
yeah. This is a great program. I appreciate it so much. So everybody get moving, get your health checked, and stay healthy. Or let's be healthy together. Yeah.
Yes.
Thank you, Kainoa.
Mahalo.
Mahalo once again for joining us. And Agnes, thank you very much. We'll be bringing in more notable speakers to give information to you, our viewers, as well as to you, our listeners on radio. And we'd like to say big mahalo to David Florendo for pointing the camera where the action is, so that our streaming on Facebook can be seen and see some content. You want to speak?
I think they done with their itik.
Okay.
And then I want to say thank you to Gwen.
All right.
Gwen, thank you so much again. We really appreciate you coming here, as well as you, little one. She has her 1-year-old with her, starting her early in terms of walking. Yeah. So, what's how did it go?
It went well. They picked up quite well. Itik Itik is a hard dance.
It is a hard dance, and we were watching it. They were doing pretty good. I almost jumped in, but I thought, they were doing so well, I didn't want to throw them off. So thank you again. We really appreciate it. Is there any thing that you want to share with the community about just dance in general and how it can benefit your health?
Well, a lot of times I've heard, oh, Philippine dance, like that's easy. It's not easy. As people have seen today, it's quite difficult and challenging, intricate footwork, and it's good exercise. So even just dancing for an hour is good cardio, And I also wanted to say that Manong Wayne's Celebration of Life will be in a couple weeks right here at Philcom Center. It'll be June 3rd at 10 a.m. And it's open to the public if people wanted to come.
Thank you. And I know you want to say something, huh? Well, when you're ready to talk, we'll have you on this mic. How's that sound? So thank you so much. And special thank you to you because I know she caught the bus. You know, she's really modeling, living healthy and being active all the way from Manoa. So I appreciate that. Thank you so much. So I'll take a break and I'll join you in a while. And I'm going to get Rochelle.
All right, Agnes, thank you. And Gwen, I was watching you from far, and the minute I saw your arms sway, I said, that's a Wayne Mendoza sway. I've known Wayne for many, many years from UH days back in the 70s. And the minute I saw your arms, I said, that's Wayne Mendoza's signature. And sure enough, when I heard you mention Wayne, and I said, wow.
He would be
really,
so proud.
Yes.
Yeah.
Yes.
Yeah, for sure.
All right.
What's that? Oh, wonderful. Yes.
Okay.
We'll be joining shortly. We have a lot of things going on yet. We will be back.
Hello. You're sharing with me the blood pressure symptom when it comes before the stroke. I like that.
Oh, yeah. Kit na sayat onay. Yeah. Amuda ka man kit di. Okay, so marita ka dita.
Okay, isa na radio. Okay. Kada tayo aming agdingdinga kakapsat kagayom. This is Pastor Engineer Atemio Lakara, member of the Simata Vision 2004. I was the logical vice president in the Vision 2004. And then I'm with Dr. Ablan, Dr. Jakang, Dr. Alita Alvarez, and then I'm with the Aloha Medical Mission too, before they changed to Bayanihan Without Walls. And I have a program in the television like Mr. Larry Ordonez with Tilmasa, with DCM. I'm a producer for Olelo, and I have a program in Ilocano and Tagalog, DCM, Jesus Christ Ministry, and then Brother of Christ International. Oh, hello, Pastor. God bless you, sir. And then I like this program because it is very educational and we reach out to the community. Amen. Okay, Karuba. God bless you, sir. So it's good that I meet you, Mr. Ordonez. I know him when he was yet the president with Central Pacific Bank,
Roland
Casinina. And then they put the time in the Filipino Community Center. And I have my name in the Community Center. Those two in there. In there, Tim Yulakar and family, Roland Pasqua, Edith, and name all the leadership in the Ilocano community, Filipino community. I know a lot of people, but it's better to be obscure rather than popular. Because when you are popular, people may crab mentality. Guyusin na ka, nuwalap someday, ikaw, watupak de bangin. So, kakapsat kagayam, this is the time to come on and have a booster for your immunity. And I'm 85 years old, but still active in the community.
Wow.
And I buy bicycle to come to the Philcom Center today.
Whoa.
And I know Brian and all those people at KNDI, from Martinez, they're my buddy. The late Benny Munoz, they're on my body. So it's good to be alive and well. All right, kaluhanga ka na saluna kakapsat ka kagayam. Awan Serbina. Now is the time. When we were born, we get gift from God. What we become is our gift to God. God bless us all. Praise the Lord.
Right. Thank you. Thank you. Yeah, Pastor Lakar. Umay kamit sumarita po. Rosales. When did that one? Oh, no, Jay. Right there. Yeah.
I said the last one.
No, times they are giving away. All right, so for those of you that just tuned in, welcome to Filipino Community Center. This is a health fair event. let's go back to our dear friend Agnes Malate. We do have another guest to say a few words. Agnes?
Yes.
No, you can use that.
So we have Glenn here with us with the National Kidney Foundation. And first of all, I want to thank you. Weren't you involved with setting up the COVID at the airport?
Yeah, we, what happened there was so many people, you got to remember back then, we didn't know anything about COVID. And so people in Seattle, actually, they were dying. And then if you look at who was actually dying, there were people on dialysis. And so automatically we said, is that going to come here to Hawaii? And so we said, we got to do something because we're not just going to wait to figure it out. And so fortunately, we knew people who was involved in COVID testing, and we brought it here to Hawaii.
So Glenn, you were ahead of anticipating what the needs were of Hawaii. And so thank you so much because that really helped a great deal in making it, really more accessible.
Yeah,
Yeah.
access was primary. And, I can tell you that the community came together, the government officials, things that would normally take months to maybe years to set up. They recognized the urgency and the emergency. And so the permitting part and all of that went through very quickly. And, the airport location, they made the airport location accessible, and the mayor and the governor, they worked together, and we all made it happen together.
Glenn, I forgot to ask you your last name. Usually I introduce everybody in the last name. But Glenn, what's your last name?
Glenn Hayashida.
Hayashida.
Yes.
And what's your role with...
Oh, I'm the president and CEO. So I've been with the Kidney Foundation now for 28 years. So it's been a long time.
That's it. Yeah, thank you for being with the foundation for that long. And thank you for making time for this event that we have, this fair.
We're very, very honored to actually be part of that and asked to be part of this event, for the Waipahu and West Oahu community. So thank you for, in your part in promoting this event.
Thank you. And then Lorene Godfrey, with Ethnic Education, how I said, you got to interview this person. I've known him for a long time, and it's so great to see people that are familiar with each other too. And it really goes back to what you were saying, like in the beginning of the pandemic, we all got together. And the government, the grassroots, Philcom Center, Philcom Cares, Ethnic Education Hawaii. So that was really important. And that reminds me of, what we were talking about, this the emergency, public health emergency ends. And that everyone's trying to figure out what does that mean, in terms
Exactly.
of the public health emergency. We still have COVID, but I think to kind of summarize it or to put it in context is just in the beginning, we all worked together because there was this urgency. But also in terms of the general health of people, kidney, that's not quite at the same level, but it is something that, we have to pay attention to.
Yeah, unfortunately, although we call, many people on the mainland say, Hawaii is the healthiest state, but you have to look at what they're measuring, and one of the things that they're not measuring is the incidence of kidney disease, so and actually diabetes as well. So here in Hawaii, it's very clear that what drives kidney failure is diabetes, and so we have such a high rate of diabetes in the state, and that results in a high rate of people with kidney failure. So we have many, like I said, I've been with the Kidney Foundation now for 28 years, and so when I first came on board, there were less than 1,000 people, I would say about 900 people on dialysis. And today it's pushing close to 5,000. And, when all of us used to drive in a community, no one saw a dialysis center. So today, wherever you drive, it's hard not to pass a dialysis center. So more and more of our family, our friends, have not only kidney failure, but then kidney disease as well.
Tiko na ni Glenn ket iti ununang when he first started working with the Kidney Foundation, 900 laeng ti cases. Itan about 5,000. Take a look. I'm talking with him in Ilocano, but 5,000 now. So it just goes to show the increase. And then no tikonana no oray no 20 papapanam iti community yo at the makita mga dialysis center. Glenn, that's so true. Dete gayem ko je Ohio. Idi may itoy. She was here for the first year of COVID, helping with her parents, and she says, I noticed that here there's a lot of dialysis centers, and then the emphasis na ni Glenn ket dete diabetes isu ti dakkel nga kaso ti kidney failure. So why is that, Glenn? I think sometimes we try to connect. Why is something that people kind of associate more with a blood sugar level, right, is causing the kidney to fail?
I think the one word picture that someone, a doctor once described diabetes, it's almost like taking a razor blade, right? If you have uncontrolled diabetes, taking a razor blade and actually it running through your veins and your arteries. So it's really ripping it apart from the inside. And so our kidneys actually have a lot of these type of veins and arteries and stuff. So diabetes actually is a driver for many, many, many chronic kind of conditions. I mean, cardiovascular disease as well as kidney. The one thing interesting about kidney though is, our kidneys are so strong and so resilient that you could lose, I would say you could lose almost some people lose all the way up to 75, even 80% loss of the kidney function, and you wouldn't know any symptoms. You don't have any symptoms. You don't even know that you have kidney disease or that your kidneys are failing. And so as a result, most people, they find out, especially if you don't see your doctor, they find out, oh, now that I have some pain in the back and my fingers and hands are swelling, by the time you have symptoms, it's already too late. And I call it falling off the cliff. That means you're literally needing to either go on dialysis or eventually have a transplant because there's no cure for kidney failure.
Wow, that's a very serious thought. That's very sobering thought. So tiko na ni Glenn, dete kidney tayo talaga na pigsa, and then oray no 80% pa lang ti kasla epekto na. If it's still at 80% effectiveness or strength or operational or function, dete di tayo madlaw. So no madlaw tayo nga dagito ima tayo ket ag swollen, even the feet, right?
Correct.
And then the feet tayo uno nasakit te bukot yo. What kind of pain would you feel in the back, Glenn?
Sharp pain. Pretty
Sharp pain?
Sharp pain.
Is it a continuous pain or it comes once in a while?
No, it will be pretty continuous. I mean,
Okay.
so much so that you feel like I need to go to the emergency room.
Yeah, so tikunana no adda nasakit ti bukot tayo nga haang agsardeng dikad daytati talagang nga seryoson. And the way he compares it is, for example, no kuma dakayanta makapuo, and you're at the edge of it, and by the time you get there, it's like already you're falling off the cliff. So this is not to scare you, but sometimes we need to be serious about it, and we need those sobering thoughts. And ata teko na nangarod di tayo marikna inga probably not until it's too late. Too late in terms of doing something to prevent you from getting sicker or for it affecting the kidney. how can you detect, and when would be the earliest that you would be able to determine?
So fortunately, the National Kidney Foundation worked closely with the clinical laboratories, and we were able to put in like a kidney screening. So as long as you go see your doctor on a routine basis, you will actually have a measurement of how well your kidneys are functioning. And so it's important. I think earlier I said people who don't see the doctor. So we really encourage, see your doctor. I know a lot of people are afraid or that they feel like they're too busy, but it's important to see your doctor. And if you can't, I know the National Kidney Foundation, we offer kidney screenings throughout the year, sometimes at events like this. And, you know, we've actually, for instance, I think Queens Medical Center is doing blood pressure here. And there was once we actually identified someone with kidney failure because their blood pressure was so high and at a community event like this. And so we rushed them to the emergency room and come to find out actually her kidneys were failing.
So that's so there are many things that your kidney will affect. I mean, if your kidney function is not functioning, then it actually your body will shut down and then it causes the other parts of the other organs to also shut down.
You're correct. Most people don't think about your kidneys being a vital organ, like the heart. But if you don't go on dialysis and after your kidneys fail, you will pass away. And so what dialysis does is it actually cleans the blood. It actually cleans the blood. But I always tell people when you go on dialysis, and people go there for 3 times a week, 4 hours at a time. But what dialysis does, it cleans the blood, but it cleans the blood it's like what your kidneys are doing right now is 24/7. Dialysis is 4 hours. And then after it cleans the blood, then it's not being cleaned anymore. So between dialysis appointments, basically what ends up happening is your blood's not being cleaned. And then there's also fluid buildup. And so that's why your life is really restricted once you go on dialysis. So you mentioned the word prevention. That's why we emphasize prevention, because we're so thankful that there's such a thing as dialysis, because more and more people would die. But you don't want to fall back on that. You know, your life will be so restricted.
Tiko na ni Glenn daytoy kidney tayo dalusan na daytoy dara tayo 24/7. Daytoy dialysis no masapol tayo to dialysis di kad mapanti tao 3 times a week upat nga oras. So dayta laang ti tiyempo ng period na nga dalusan ti daram. So dayjay da duma nga oras nga di dialysis because they dara ket kasla hang ma refreshen kuna hang ma cleanse. And so imagine that, you know, no that the kidney tayo it's working 24/7, but if it's only working say 4 times a week, 3 hours 4 hours 3 times a week, then that's only 12 hours. So that's not even half a day. So just as that as a comparison. So pampanunutin tayo masapol nga di tayo I guess don't be scared di tayo butbutan no agpa-check up. And then I know there are many of us, you know, we don't want to know the result nakarkaro no di tayo mapan and get our checkup. And so what health tip do you have for, you know, staying healthy?
You know, we are our best advocate for health. Many people, unfortunately, are so busy. We kind of take it for granted. and we need to take control of our health. And so nutrition, we have nutritional classes, for instance, at the National Kidney Foundation. We control your weight, not just reduce weight, but and we're saying also healthy living. Be physically active. Nowadays, adults, we're all busy. So we go to fast foods and restaurants and things, and we don't really pay attention to the things that we eat. So I think we just need to be a lot more intentional about what we eat, where we go to get food. I'm not saying never go to one of the fast food restaurants, but we really have to look at limiting that so that we don't depend on that for, all the time, because we are busy, and I realize that most of us are saying, it's fast, it's getting more expensive, but normally cheap and it tastes good, right? Those are the three things. But when you look at that, it's not healthy. It's getting more expensive. And actually, if you look at the cost, it's actually costing you more, because we can't buy health, right? Once you lose your kidney, you can't buy a new kidney. And so it's actually costing you a lot more. So, I encourage people, keep health and your health status top of mind. Make it a priority, especially as we grow older.
I think Glenn said, this kind of reminds me of that Filipino proverb or saying, health is wealth, right? And I guess in many cultures, take care of ti pagpagi tayo, ti kunana, deta importante, that tayo ti advocate, champion para ti pagi tayo. So they masapo nga di tayo neglecten, they pinang tartariwan tayo, they health tayo, they fast food, they ti may sapay nga makontribute ti they salon at titihan tayo nga salon at unay, they pay, and talaga nga ito'y Hawaii aduti, they have two jobs. Doti trabaho da to sono da do market. You were always on the go, yes. Awan tiyempo tayo. I am guilty, Glenn. Larry is I'm Larry. I'm trying not to look at Larry, but I am guilty in terms of going here, going there. But you are right, because when I went to Hilo, visited my family for Mother's Day, celebrated, I come back refreshed, and you're more intentional. Panunutan nyo tayo nga talaga, ana deto'y sitsidaan tayo, kangkanan tayo, deto'y lifestyle tayo, masapong nga maturog tayo pa'y, hanang yung bagaday tayo, that's part of being healthy, to sleep, not neglect our sleep. So, I know probably Larry wants to add more to that, or yes.
My kids have been monitoring my intakes. So they tell me, Dad, you're not getting any younger. Your muscles are declining. And at your age, you need to be more preventive of doing things. Your intakes cannot be the same as your intake when you were younger, where you fill up your plate with all kinds of stuff. And they said, eat half. I was joking around earlier, but eat half, Dad. That's the first thing, because you don't want to go to dialysis. Who's going to bring you to dialysis? And I look at my friends who are on dialysis. It is really hard for the rest of the members of the family, especially if the children are professionals. They don't have time. They have certain obligations, and then when they come home, they have the kids. And so, Dad, you need to be more mindful of the things that you eat. That's the first thing. And then couple it with exercise. So when Dore Villaferte of Bayanihan was talking about walking, Yes, I agree. And I'm so glad that I am here because I get a chance to meet people like Glenn Hayashida. What's Sagayodoro's first name now?
Tony.
Tony. Yeah.
I know Tony. I knew Tony.
Yeah.
Yeah. Tony was with us.
He was
here
well
and there.
loved.
Yeah.
Yeah, Tony was well loved. I actually met him soon after he had his kidney transplant, and he dedicated his life and to the cause of raising awareness about kidney disease as well as transplant. But you know, Tony would help anybody and everyone. So you know, we all know Tony as being someone really special. And I saw him at Queens when he was near the end, and was able to actually talk to the daughter and things. But yeah, I miss Tony. Tony was a special person.
Yes, so there was one thing that Glenn said that I didn't kind of interpret. Di ko nanakit no, you come to that point na failed data kidney yun, it's really going to change your life. And that's one thing that, you know, the things that we take for granted, talaga agsabali tibiyag tayo. So that tatapin panunutin tayo, hanlang nga tayo, dagiti familia tayo.
Absolutely. And you mentioned something very important in terms of portion control. So that is very important. So, you know, we never advocate to say, you know, stop eating things that you like, but eat less of it and eat it less often. And so that it's not like it's an all or none type of situation. So,
Glenn, if we were to go take out, I'm not going to ask you to name a restaurant, but what kind of food would be more on the healthier side?
Again, it's not an all or none type of thing, but you know, eat more. Right now, I think the recommendation is more like plant-based diet. So eat more of the plant-based type of diets and less of the especially processed foods. We want to really stay away from the processed foods.
Great. Thank you for that advice. Really appreciate it. I'm glad you're here today and we got a chance to have a conversation.
Yes, thank you. I really appreciate the opportunity to share. I mean, that's part of what I do, and it was great meeting both of you. So thank you so much.
Same here, Glenn. My name is Larry Ordonez. I worked with Tony several times on many of his remote broadcasts. And I still remember having to carry equipment, and at the end of the day, he would be holding his back, and I would say, and he would tell me, yeah, I have kidney issues. So
I forgot, actually, you knew Tony well, too, so.
Well,
Because
thank
he
you
was a
again,
KBI
Glenn.
too.
Thank you for your time.
Thank you.
Thank you so much again.
And
Thank
thank
you.
you to Lorene Godfrey, Ethnic Education Hawaii, for bringing you on our table.
Thank you so much.
So there are healthier options upstairs. I saw some of the food that was out there. But thank you, Glenn.
And once again, you are listening to activities happening here at the Filipino Community Center in Waipahu. Hosting our health fair program are Dr. Agnes Respicio Malate and Richelle Patage. And we do have another one of our notable speakers to join us. And now to
Hi,
you,
Larry.
Richelle.
So this is Rochelle again, and I'm here interviewing Mark. Mark, what is your organization?
Mark Armas, my name, and I'm with Plan Advisor Hawaii. So that's a local agency, and we're doing Medicare, Medicaid, helping people, and to enroll, do the qualification for Medicare and Medicaid. If they qualify, then we help them for more benefits.
Yes, so earlier we had a good conversation with Aloha Care and with Plan Advisors about Medicaid. So the business that that they're running is that they're helping people get their health insurance or Medicaid services. So it would be MedQuest in Hawaii, and MedQuest is the government aided health insurance. So we did have some interesting conversations between Aloha Care, Plan Advisor, and Philcom Cares. One of them is what happens when you don't choose your Medicaid insurance provider? What happens when they don't choose?
Okay, so what happened is once the beneficiary or qualify for Medicaid, and the state will do that for qualification, yeah? So after that, if they are qualified, then the carrier like Aloha Care or maybe United Healthcare, they automatically enroll them without any choice for their Medicare. So I have to remember that Medicaid and Medicare is different. Yes, so Medicaid is a state government program, and Medicare is a federal insurance.
Okay, wait. So Medicare is the federal insurance, and Medicaid is state. Okay,
Yes.
and then so Mark was saying that if you don't choose your provider, it automatically goes to United Healthcare, right?
Yes.
Oh
So
yeah.
not
so-
everybody. For those that under 65, yeah, the state will randomly distribute to any of the carrier like United Healthcare, Kaiser, HMC, or Aloha Care, you name it.
And that's a pretty fast process. I remember family members getting the United Healthcare plan even when they didn't choose. So, I mean, how can I choose other providers if I already was automated to United Healthcare?
Yeah, so the only thing that we do as a broker, so we try to talk to the beneficiary, and if they select a specific career, then we discuss everything what the offer, and they could have a chance also after 3 months they can have a switch to other career. So example, maybe they have Medicaid with the United Healthcare. Automatically, once they became 65 years old, they automatically go to the United Healthcare for alignment with the same company. Yeah.
Wait, so you
Then
mentioned
after
that.
3 months,
Yeah.
then they have a choice to switch to other care like Aloha Care or maybe other plans.
Oh, wait. I thought it was immediate, but so
Or
we're actually
immediate, but
immediate?
after 3 months, then they can switch the plan.
Oh, okay. So if they're automatically going to United Care, they have to wait 3 months to actually switch the
Yes.
plan. Oh, okay. But that's is that pertaining to just ages under 65 or?
65 and over.
Oh, so that situation is for 65 and older. Okay. Who usually are your customers? Are they 65 and older, or are they just the
No,
younger folks?
Okay, so the state is Medicaid, which they serve under 65 and over 65.
Oh,
So now, under 65, then they have no choice, yeah? So only if they assign to, like I said, is randomly distributed to any of the carriers like United Care or Aloha Care, WellCare, then only they can switch the plan once a year.
Oh, yeah, I know. So when we were talking about redetermination, so just a little backup, redetermination is requalifying you for Medicaid and other health insurance, or Medicare. And that happens just once a year. I asked Mark earlier, so is this a month that we expect consistently the same month every year? And he said,
Yes, that would be October.
October.
Every
Okay.
October, yes.
So every October is the
Every October, the state will send you the letter for the beneficiary. If you want to stay with your plan and you are satisfied with that plan, then don't change. So now, if you want to change for other, then you could send the letter to change the plan.
Okay, so if you don't want to change, leave it alone.
Yes.
Right? Okay. And then before you get all of these, before you even qualify, before you get enrolled, I know that you were saying that the notices that we get in is in the mail, and there are color distinctions on what your envelope color should be. So what is the white envelope and what is the pink envelope?
Okay, for this year only, this is not only in Hawaii but nationally, because during the pandemic, everybody applied for Medicaid, right? And now some or most of the people, they went back to their work. So these are all, we're talking about under 65, like maybe like the hotel workers, they don't have no job during the pandemic, they run out of their medical. So now they apply with thousands of employees apply for Medicaid. Then now they went back, so normally they should tell to the state that, hey, I'm already back to work, I have medical, but not everybody reported that they have already working. So now, nationally, not only in Hawaii, that they have to do the predetermination. Either under 65 or over 65, they have to do the pre-qualification again.
So that's the pink
now-
color, right? Pink
No.
envelope?
Before the pink letter is white letter, telling that everybody has to inform them that there will be a predetermination at starting, I believe, May to May also 34 1 year.
Oh, okay. So before getting qualified, you're gonna get a notice to re-qualify, and then the first
Yeah.
envelope you'll get is a white envelope.
White.
The white color envelope is to
To
notify
inform
you.
them,
Yeah.
to make sure also that they have to report if they change their address.
Okay. And then the pink
The
one.
pink one is a specific month that you have to submit your pink letter.
Oh, okay. So the pink is more urgent, telling you that you have a deadline, pretty much,
Yes,
right?
yes.
Oh, okay, okay.
You got 1 year to enroll.
Oh, that's a lot of information. But I guess the simple thing to look out for is either a white envelope or pink envelope, right?
Yes. that's-
Okay. So I think that's also important for Filipino communities, because do you believe yourself that, do you believe that the Filipino community would be your highest clientele, or who are recipients of the Medicaid and
Right
Medicare?
now, yes, look like most of the Filipinos and could be Chinese also.
I know we have a lot of language sources, and luckily we have Candy Larry, who's gonna speak in Filipino language with Clement. We have Office of Language Access here. We got Philcom Cares, the Office on Equality and Access to the Courts. Those are really great sources for interpretation and translation. I know the medical side. On your side, do you have any personnel that could speak Ilocano or Tagalog?
Oh, actually, our agency, we have about 50 agents here in Hawaii.
Uh-huh.
Yeah. Plan advisor is all over, but we have about like 90. But in Oahu only is about 50 agents, and majority is Ilocano. We have Bisaya, we have Pangasinan, Pangasinan, yeah, Tagalog. So,
So
we get
you-
the most.
Yeah, you're
Agents.
pretty covered on the Filipino languages, huh?
Yes. So, a lot of beneficiary there that they don't know about the a lot of help that we can get from state,
Mhm.
like Medicaid, or if they are not qualified with the state with Medicaid, they could be qualified also with extra help.
Mhm.
That would help a lot of our members for this kind of help from the state.
How are they gonna know about this information? If well, especially they don't speak English. How does your customer normally know? Family?
Okay, so most of our members or whoever that, because we work with a kiosk on every store also, most in the like CBS, Safeway, we are there to we're telling them that if they have Medicare, then we qualify them.
Okay, so
In other
you have a
words,
table out at the
yes,
stores or something.
we help them for, we ask for their income.
Mhm.
If we know that their qualification, then we help them. We don't get any commission on helping them, but once they have a Medicaid, then we can help them also with Medicare. So in other words, like Medicare, everybody is paying about right now for the Part B is 164.95. But with their qualification of their income by asking them question, we qualify for them for extra help to help or remove all of those 164.95.
Wow, that's very specific. He knows the amount. $164.95, he said.
Plus, not only that, if they qualify more on the Medicaid, they have like dental coverage for 4,500. They have like $175 for additional healthy food or over the counter, so a lot. So mostly they happy.
Oh my! So
by-
you know
by-
those things are gonna add up. I was asking Aloha Care how much is it to spend on the medical. So she said about $800. Oh my gosh, that's for $800 for one person. $800.
Yeah, because
Crazy.
Aloha Care, they have $3,000 coverage on the dental. That would be include the dentures, their crown, and everything. So long as they don't spend that 3,000 over, is zero.
Yeah. So Mark is saying that he's basically telling me your invoice, right? He's telling me how much a crown and denture and what else did you mention?
Implant, except
Implant.
implant.
Oh, except for implant. Oh,
What number can they call it should our listeners have any
They can
questions?
call my number, 808-392-3840. Then I don't want to...
And ask for Mark.
Office also.
well, what is your number again? Could you repeat that, please?
808-392-3840.
3923840.
And we are available 7 days a week.
He said 24/7. No, I'm just kidding. 7 days a week. But it's really important to get that covered, especially this time of the year. And thank you for giving out the information. I think we have one more guest. Thank you.
Thank you.
Mark, thank you very much for joining us on KNDI Table. Thank you, Mark. Plan Advisors of Hawaii. And for those of you who may just tuned in, this is a health fair event happening right now here at the Filipino Community Center. And this is sponsored by Philippine Medical Association of Hawaii, the Filipino Community Center, Philcom Cares, and Dirigo Health. I'm Larry Ordonez, back to Dr. Agnes Respicio Malate.
Hi, I'm back again here, and I just realized that it's almost 1 o'clock. Did you know that?
yeah, we got 20
time is
minutes.
going by really fast. And here with us today, we have Dr. Anna Lowe, and joining us as well is, yes, Charmaine
Gonzalez.
Yes, Jan Gonzalvo. And actually, this Spring into Health kind of started with you and Dr. Rhea talking about it with Dirigo Health, and then it emerged into something that was open to the entire community. So tell us about your healthcare organization and yourself. Oh no, just tell us, yeah.
Hello, aloha, good afternoon. I'm Dr. Anna Melissa Lowe. I'm one of the local endocrinologists here in the island. As an endocrinologist, I deal mostly with diseases with the hormones and metabolism. So, patients or people in general with problems with their diabetes, thyroids, and other hormonal abnormalities. I do work in the primary specialty clinic of Hawaii, and this is under like the branch of primary care clinic of Hawaii with Dr. Charlie Sonido. So it's been a great opportunity to kind of like serve the Hawaiian community. I see a lot of patients. I also speak Tagalog, if that's a plus. And so, if any Filipino people out there.
We'd love that. We haven't heard Tagalog for a while in our conversation. So, yes,
Let's go ahead and speak in
Many of
Tagalog.
our listeners-
Okay lang po ba?
Okay
I just
lang
want
sa
to
amin,
make sure.
oo.
Hello po mga kababayan. Aloha. If you ever need a doctor po in diabetes or whatsoever, I am hopefully your doctor.
Hello, hi everyone. Ako naman si Charmaine Gonzalvo. I'm one of their advanced practice registered nurse practitioner. And like what Doc Lo was saying, we're part of Primary Care Clinic of Hawaii, and we're committed to providing competent, compassionate, culturally sensitive care for all of our patients. Marami po kaming mga pasyente na, they're Filipino, so we can provide that culturally sensitive, especially mga language barriers. Then most of our providers can speak Tagalog, Ilocano, and we even have Chinese providers that can also speak and provide that care. And our goal is to improve and continually strive to perform standards while maintaining. We also welcome new patients with us. Currently, we just opened our Wahiwa Clinic that's located in California Avenue at the Medical Arts Building. We are currently open Monday through Fridays, and we're welcoming new patients. Our services, we include adult medicine, acute pediatric care, women's health, primary care providers, telehealth, workers' compensation, no-fault, third-person liability, minor surgery, physical exams for school and work, and also yung mga TB skin tests. So if you guys are interested, again, you guys are always welcome to visit us, visit Dr. Lowe, again, with our specialty. We closely monitor those patients, especially maraming sa mga Filipino. We have diabetes patient, right? We specialize also in hypertension, yung mga high cholesterol nila. We'll make sure that we give you the most utmost in care. Thank you.
Well, it is so wonderful to have both of you here. Hopefully, I don't ever get to see you at your
Hopefully
offices.
not.
Only at these events.
Stay away from our clinic.
Stay away from me. But in the event that some of our listeners or us come to see you, we know that we can understand each other, we can express, we can tell you kung ano ang masama sa loob namin. Oo, so
Yeah,
that's very, very important. And
Yes.
I'm glad you spoke a little Tagalog because we do have a wide range of listeners, Tagalog speaking, Visayan speaking, and lots of Ilocanos. And that's why Agnes is coming in so handy hosting this affair today.
I actually wanted to ask a question because when people go to the clinic, right, they want to see a doctor. And I know, nurse practitioners are also in a position to be able to see the clients, the patients, and have the training as well. So would you like to say a little bit about what a nurse practitioner is?
As a nurse practitioner, again, being a primary care, we're considered as a provider, advanced provider. So in this type of setting, primary care outpatient, we do see patients that if you have chronic conditions such as hypertension, again, dyslipidemia, diabetes, those type of conditions we can help manage. We can help under the supervision of physicians. We can help take care of that and help manage and prescribe, such as prescribing, can diagnose. Also, if, let's say, you're sick or there's, some aches, pains, you're having shoulder pain, anything wrong, we can also see that as your primary provider.
So there you have it. When you go to the clinic, it's about seeing your primary care provider And it's not just MDs, physicians, but also nurse practitioners, and you will be in good hands. So thank you to both of you. It's been great having you here. And
Thank you for having us.
Yes, thank you for having us too,
Yes.
and giving us the opportunity to be able to spread the word and talk about our clinic.
Wonderful. I
Thank
hope-
you so much.
I'm sure we'll be seeing each other again, not at the clinic, I hope, in terms of
Yeah,
the
hopefully not, you
specialists.
guys.
Yeah, different setting.
At other settings. Thank you.
Thank you so
Thank you.
much.
Thank you.
Mahalo.
Mahalo, both of you.
Yes. And next we actually have Dr. Rhea Bautista will introduce this next guest. And we'll have her. Are you joining us too, Dr. Rhea?
Oh.
And then we have a beautiful mic there also waiting.
Oh, hello again.
Hi,
Hello,
hi,
Crystal.
welcome back.
Oh, so I have with me my husband, Dr. Rainier Dennis Bautista. I just wanted to introduce him. He's a part of the PMAH, the Philippine Medical Association of Hawaii, and also a physician at Primary Care Clinic of Hawaii as well.
Yep.
Thank you for being here. He's
thank
been
you.
a big supporter and volunteering to help with this event.
Mm-hmm.
Or is it voluntold? Oh, I'm not going to say. But Dr. Rhea is the chair. We may not have mentioned it earlier, but she is the chair of this event. Thank you so much for leading this, our committee and Dr. Dennis Bautista. I know we'd like to know more about PMAH because PMH has been one of our strongest partners for Philcom Cares, and it's preceded Philcom Cares and has been there for the community since, I don't know, over 30, 40 years maybe even.
Almost 40 years. The Philippine Medical Association of Hawaii is basically an association of physicians, nurse practitioners, basically any provider that provides care to the Filipino community now. We help our member physicians with regular like education regarding updated medical guidelines through our CMEs. Also, we provide support for times of need, like for example during COVID, we help our members get PPEs or personal protective equipment. Another thing we do is we have several affiliates that actually have direct impact on the community. The first is the Bayanihan Clinic Without Walls, which provides free medical and dental services for new immigrants. We also have under us the Ohana Medical Missions, which who does medical missions in the Philippines once or twice a year. They recently had a medical mission January. Then they're gonna have another one soon. Yeah. And the last is the Philippine Medical Association of Hawaii Foundation, which helps medical students as well as pre-medical students to we help them get into medical school, and then we support them during their medical school journey, so that we are able to have more homegrown physicians, especially Filipino physicians here in Hawaii. Yeah.
And they wear many hats. They have several roles. And they've actually been the leader, at the start of the pandemic with their TikToks. They've been doing an awesome job in mentoring the students and really increasing the percentage of Filipinos in medical school. But they not only, if I understand correctly, support Filipinos, but others from...
Oh, yeah.
Yes.
The mentoring is open to anyone who's interested in getting into medical school.
And I understand there's a few big events coming up at the ending of the month and in January as well. I mean, June.
Yes. Memorial Day weekend, we're going to have our CME, which is Continuing Medical Education. which is for physicians and nurse practitioners and other providers to learn more about various topics, medical, to improve their medical knowledge. Oh yeah, sorry. And then in June,
It's Father's Day, I believe,
yeah,
in Hilo.
yeah, in Hilo, the Bayanihan Clinic Without Walls will have a health fair in Hilo, and then come Labor Day, we also have another CME. That time will be more focused on diabetes.
Okay, which is very much an important health issue. And the reason why he's here is because he's the incoming president, aren't you?
Yes, yes.
Yes.
I'll be taking over start of 2024. So I'm just
2024?
president-elect now.
Oh, so you're president. Well,
Yeah.
congratulations. Look forward to working more with you, collaborating actually.
Yes,
with
of
you.
course, of course.
And we're getting a head start here, and so hopefully next year we'll be here again.
Yeah,
With
of
another
course.
spring
Yeah,
into health. Yeah.
Thank you so much.
Yeah. You have any tips for staying healthy?
I think the issue that I'm most passionate about is obesity. So I think the medical community has a lot to work to do in terms of imparting or teaching our patients about the importance of proper diet and exercise, as well as working hand in hand with their providers to combat the obesity epidemic.
He actually is lecturing at the end of May on this exact topic.
okay,
Yeah, and then and he's double board certified in family medicine as well as obesity medicine. So he really knows
Well,
what
the
he's
expert.
talking about.
There you have it. Dennis?
So where is that class?
It will be in the Four Seasons in Coalina. Yeah. We are actually streaming it, but it'll be more for the medical providers to kind of teach them how to treat obesity as a chronic disease. Yeah.
That's actually very important because that's related to other health issues, and then with COVID, that's one of the risk factors.
Exactly.
That was mentioned. Yes. So I think that the one that Four Seasons, we were fortunate last year to be able to share our journey of Philcom Cares, and then actually 10 years ago in 2013, there were a group of students who were at the CME at Turtle Bay.
Oh,
And there was
yeah.
the first time I think our university collaborated with PMAH for our SEED PMAH mentoring program.
I
So
see.
that's kind of like
Oh,
was
yeah,
the
that's-
seed.
Mhm.
And so great to see that it's
yeah.
gotten even more students involved, and it's really born more structure under Dr. Hayes, Abin Sai, and of course
Oh, yes.
all
Oh,
the
yes.
PMA
It's
docs. Yeah, so congratulations. And
Thank you so much.
have a great CME, and we'll still be here. We're now 6 minutes. I can't believe that until the ending of this.
That means you
broadcast.
really enjoyed doing what you did today.
Yes. And of course, time went by so quickly. We'll still be here. I want to announce, make sure that the public knows we're here for another hour. It seems like it's getting busier, or either that people getting some food or something. But it seems like traffic has picked up, and we want to make sure that we're here. The broadcast will be done at 1 o'clock, but we'll continue to be here until 2 p.m. So please stop by the Filipino Community Center in Waipahu. If you look at, you're coming from the Farrington Highway, you'll see the smokestack from the old sugar mill. If you're coming from the freeway, don't go into Waikele right now. Come down to Filipino Community Center. And when you see the golden coin, take a right. I was going to say left, but take a right. And then you find your way to Filipino Community Center in Waipahu. Providing this, being sponsored by both the PMAH, Philippine Medical Association of Hawaii, Dirego Health, Filipino Community Center, University of Hawaii Health Careers Opportunity Program. I think I got all of us in there.
Yeah.
Okay? And so we have a few more minutes left. I think we're going to go off at 1 o'clock, so you continue on, and I think Dr. Rhea and Carl will have some words to say and thank you and all that. Yeah, so thank you so much, Dr.
Thank you, Doc.
Dennis Bautista. Yes.
All right, now back to Doc Bautista too.
Dr. Bautista, yes.
Yeah.
Thank you. I just want to say maraming salamat po sa inyong lahat. This event is our first event and very successful. I think a lot of people have come and enjoyed the company, all the exhibitors, all the education that was provided here. We are planning to be here next year, so hopefully, everyone who came will come back. And I think, the important thing about Spring into Health and how it came about is more we want to share the prevention aspect of medicine and how it's important to take care of yourself before you get sick. Because when you're healthy, that's when you can help take care of others. And I think Larry said it earlier, where if one person gets sick at the home, then it causes, the domino effect of the stress levels of the family. And then we know here in Hawaii, where it's a multi-generational, we take care of our elders. So myself, I have to make sure I'm healthy so I can take care of my parents. I think we're waiting for Carl, but just lasting words is thank you so much for everyone's participation in today's event. None of this would have been successful if we weren't here. So it takes a family to raise a village, or takes a village. I messed that up. It takes a village to raise a family. Sorry. I'll pass it on to Carl now.
I like the way you said it. It takes a family to raise a village.
I
think it works both ways.
Yeah, it works both ways.
So I can tell you, I learned a tremendous amount today.
Same here.
We had so many great exhibitors. I got a chance to go around and talk to a lot of them. I was just talking with Aloha Care about the great things they're working on. I was talking with MDX Hawaii, who, with Humana and United Healthcare, they support there. Had a chance to talk to Hanaho. And one of the most interesting was the Waipahu High School and their Health Academies program, getting young people ready to get out there and take care of our aging seniors, our working middle class, and provide them the best health care possible in Hawaii.
We have 30 seconds.
Oh, so sorry, I'm getting a little long-winded there. Thank you for the notes. But, hey, thank you so much, everyone, for coming. And any last words that you would like to say, Dr. Agnes?
Yes. Thank you again to everybody. And one last word is that next week we'll be on the radio again for our Radiothon. Philcom Cares will be sponsoring that one. So join us again. It's almost like we want to invite all the other guests who we weren't able to interview. So from all of us here at Philcom Center, aloha. Yeah, that's shaka, right? We're still on Facebook.
Agpaiso kadida iti damag amang mangyeg po iti COVID-19, kasano paneknikan dagitoy a damag, maituloy a libre kadida iti bakuna, booster, ken test, kalpasan kadin iti COVID-19 a pandemya. Itultuloy mi, FC Cares, at tumulong iti komunidad ken adda kami manen ditoy radyo, tapno kadawaan da kayo asumungbat kadagitoy ken da dumapay. Philcom Cares is federally funded through Hawaii Public Health Institute, administered by the Philcom Center.
Playing more music online. This is
KRM Internet Radio.
your #1 internet radio station. Play more music. We are
The Pinoy Sound.
Music on the best station.
You are listening to the Pinoy sounds of KRM Internet Radio here in Maui, Hawaii. Aloha.